Good morning and namaste. I'm Dr. Prerna Jha, and today I have come up with the topic which is concern of everyone and which is very commonly found in our society, that is anxiety disorder, घबराहट को बीमारी. So, what is anxiety disorder? Anxiety disorder is abnormal state of our body which strikes the features of both mental and physical symptoms of anxiety. So if we talk about the clinical features, it affects all the system of our body. For example, if we talk about the respiratory system, then patients complain of chest tightness, breathlessness, and choking. If we talk about the cardiac system, then the patients complain of palpitation. Sometimes they explain by saying, "My heart is knocking the ribs." If we talk about the genitourinary system, then the patient complain of increase in frequency of urine, stools, and sometimes loose motions also. And if you talk about genitourinary system again, then patient also complain of difficulty in erection and menstrual irregularity as well. If you talk about gastrointestinal system, then patient complain of the dry mouth, difficulty in swallowing, epigastric pain, difficulty in digestion, and even loose motions. So if we talk about different types of anxiety disorder, there are generalized anxiety disorder, which is also known as GAD. There are specific phobias, social phobias, and agoraphobias, which comes under the phobic disorder, and there is panic disorder. What is generalized anxiety disorder then? Generalized anxiety disorder is such kind of anxiety in which the anxiety is continuous but only the intensity is fluctuating. भनेको घबराहट कन्टिन्यू हुन्छ तर बढ्ने घट्ने मात्रै हुन्छ, नर्मल पुगेको हुँदैन. If you talk about the phobic disorder, then the anxiety is intermittent and related to certain circumstances. भनेको एन्जाइटी डिसअर्डर आउने छोड्ने हुन्छ, नर्मल नै हुन्छ, फेरि आउँछ तर सर्टेन सर्कमस्टान्सेसमा. For example, there is specific phobias. Phobias after seeing the blood, there is injection phobia, phobias in airplanes, phobias of height which is known as acrophobia, phobia of spider that is known as arachnophobia. So it is specific phobias. If we talk about the social phobias, then in this patient try to escape the mass or gathering because they feel people may judge and make fun of them. So even if they have to face the gathering, they try to avoid by sitting in the corner of the room. And there is another phobia called agoraphobia. In this kind of phobia, patients try to escape the crowd places. For example, they feel anxious if they are sitting in the movie hall, even in beauty parlor or in elevator. It is sometimes associated with panic disorder, sometimes not. So what can we do to treat these phobias or anxiety disorders? So there are pharmacological treatment that we can go for, like selective serotonin reuptake inhibitor, benzodiazepines, selective norepinephrine reuptake inhibitors, and sometimes other drugs also. Like it depends upon the severity of the illness. And the therapy which we can give is the behavior therapy, like sensitive desensitization, which is dependent on the classical conditioning, and principle is reciprocal inhibition, in which patients are faced to the feared stimuli in hierarchy form from least fear to the most fear. If you talk about the list, then suppose patient is scared of spider, then first we tell patient that spider is there in your classroom and now you have to go in that classroom. Slowly someone will tell him that there is a spider crawling in the TV or television. And then someone will tell him that spider is beside your bedroom, and then the most fear will be spider is inside the cup of your coffee. Then in this way, the by relaxation technique, the fear of patient will become less. The another therapy is flooding. Flooding is based on, again, the principle that fear and relaxation cannot occur at the same time. Either of them will win the other, whoever is stronger. If your fear is stronger, then your fear will win the relaxation, and if your relaxation is stronger, then it will win your fear. So in this, what will happen is, if patient is scared of height, if patient has got acrophobia, then patient is asked to face the height slowly. Initially, he will ask to see or watch the movies in which the scenery will be of a 10th or 20th floor, in which patient is standing right uh, in very much height. Then slowly he will be shown a photograph in which patient is standing in the height. Slowly he will himself be asked to go in the elevator, the transparent glasses made of elevator, from where he can go up and down and practice, so that his fear will be weakened. In this way, he can practice and he can win over his anxiety. If not relieved by all of this, you have to go for pharmacological therapy, which cannot get in over the counter without prescriptions. So please meet psychiatrists for that. Thank you so much. Stay happy and healthy. Yes, mentally healthy.